Welcome to Think Big with Dan and Qasim. Join hosts Dan Melnick and Qasim Masood as they explore big ideas, limitless possibilities, and engage with visionaries, entrepreneurs, and thought leaders who dare to dream big, get inspired, motivated, and find practical tips for personal growth. Think big, dream bigger, and ignite your potential.
All right, welcome to Think Big with Dan and Qasim, and our guest today is Sheila. So Sheila, if you want to go ahead and introduce yourself, tell us where you live and what you do for a living.
Hi, Dan and Qasim. I live in St. Louis, Missouri. Well, technically St. Charles. I am the CEO, co-founder of Buswell Biomedical. We're developing a medical mobility device to reduce lawsuits in hospitals.
Awesome. So can you just tell us more about how you got the idea for this product?
So in 2018, my mom fell and broke her hip. And in 1998, I was in the military and I was I was deployed to Bosnia, and I was injured. I had a generator fall on my foot, and I had rehabbed there, but I was, 21 at the time. And I'm sure you guys have been 21, but maybe not all your listeners have been 21. You're certainly not self-aware. But when in 2018, I was older and I had the education, and I'm not a caregiver. My first impulse was to burn the rehab facility down. I'm not even mean, but I wanted to be mean to the healthcare workers, not because they were doing a bad job, but because there just wasn't enough of them. So they couldn't do the job they needed to do. And as a result, my mom suffered. And after I got a medical discharge in 2001, I got a mechanical engineering undergrad, and I worked for a lot of great companies, and I got a master's in engineering in 2015. But most of my career was automating, right? So I automated jobs and worked for research and development. And I was like, well, my mom needs help going to the bathroom. Or all the activities of daily living, and it's a systemic problem. And so I figured out how to automate that specific task. And then it grew to all the activities of daily living, not just going to the bathroom. I am not like the other entrepreneurs you've had on your podcast. Like at first I was going to go work for somebody else who's developing this device. Like I 100% am risk adverse. Like that was my impulse. And then I was like, oh, nobody's working on this. I need to work on this. And then I got a patent, and if not me, then who? So that's where I am. A year later, I started a business and got a patent attorney, and here we go. Anyway.
So I guess like where you're at today, right? So you mentioned that you're still working on this product, right? Are you still kind of in the R&D phase, or is it going to go live soon? Like where are you guys at in the pipeline?
So we're building a prototype of the mechanical prototype. I've had the sensors that are going to control the device. I've been collecting data, which was awesome to go during the pandemic and be like, stand up and sit down for science, young men. Like I'm a middle-aged woman. It was scary. The whole pandemic to not act like the Tasmanian devil on a sidewalk when somebody was coming at you. The early days of the pandemic, it was definitely weird when somebody was like, wear this harness and stand up and sit down. It's weird. There was no way to not be weird. But I collected a little over 100 samples of people's motions. So we're at a point where we need to tie those two together. So
makes sense. So in terms of like your ideal customer, right? Is it going to be something that's going to be sold to hospitals or more direct to the patients? Like where do you see that coming in?
So I'm sure you've heard the tagline, the riches are in the niches, right? So specifically rehabilitation hospitals, and most falls in the hospital happen between 11 p.m. and 1 a.m. And the idea is to automate the task of activities of daily living that you would need help. Traditionally, you would need a healthcare worker there's a lot of lawsuits by healthcare workers and patients, but they sue the hospitals, and hospitals buy expensive equipment like this through hospital purchasing groups. There's 7 in the entire country. There's 1 here in St. Louis, and that's who our ideal customer is. But we need the buy-in from the healthcare workers and from, the people every day. But I think most people would prefer to have this machine help them to the bathroom than, healthcare worker. As much as people fear technology, artificial intelligence, like my mom thinks artificial intelligence, she thinks like a Terminator type device. She doesn't think Big Hero 6. And now people are thinking Chat GPT, although that's not exactly correct. Obviously, a large language model is not going to help you to the bathroom. That is an easier hurdle to overcome. It's not Big Hero 6, but yeah.
Yeah, makes sense. So what are the biggest challenges to being an entrepreneur?
I think besides the technological challenges are part of being an engineer total, but like the loneliness of being an entrepreneur, like you are incredibly lonely and nobody talks about that. Like there was always somebody in the cube next to me when I worked at a large company. When I'm an entrepreneur, there's nobody to the left and right of me. I talk to my dog a lot. And I think finding a community, and then nobody knows what you do. Like people think, oh, when you invent and have a patent, they think, oh, like it's so hard to explain this to somebody who doesn't do it. So I think the hardest part is to be alone and to, do all the things. And sometimes you're humble and sometimes people don't understand what you do. And that's got to be okay.
What
You
about
gotta
like
believe
biggest
in
challenges that you're facing in the business like as a whole?
day to day it changes, but I think right now it's like bills are coming due. It's the end of the year, so there's a lot of money problems right now. Like it's either famine or feast, right? Like I either have thousands of dollars or no dollars, and it's trying to find an equilibrium and balance there. And
Did
I
you guys
haven't.
raise money?
No, we haven't yet.
Okay.
Honestly, I've gotten grants and I have used my funded by Sheila's 401k and savings and part that I put aside, but like we haven't gone out and gotten no.
So in terms of like your ideal customers, like you mentioned these, special hospitals. So has there been buy-in from the hospitals? Have they like verbally committed? Have you started these conversations? Like what does that process look like for you so far?
So early on, like in 2019, it was before the pandemic. I don't know if you guys heard that the country shut down or the world. And we would talk and they'd be like, well, when are you gonna have a prototype? And I'd be like, in 6 months. And then 6 months came and went. And there was times where so we went through 4 designs because of gearboxes. The initial gearbox I had designed around we couldn't get, so we had to redesign, and so that 6 month time frame kept getting moved out. That prototype, and then so that fell off. That's one of the reasons we haven't gotten funding, and that's one of the reasons we kind of dropped off that discussion. Anytime I have talked to healthcare workers and every stage of the hospital worker, like management on down, and it's very different. It's not there's people facing and there's business facing, because it's not a charity. In our country, it's not a charity, and
Right.
it's very difficult to, because they're looking at the same problem from a different angle, because they're very interested in solving the problem. It's just how it's approached, and I don't have an answer. Like there was a time when aluminum was 400%, like the value of it, so I couldn't buy it then. We had Frankenstein parts in the basement. So when we're going to get this prototype? Well, that's a good question. I don't know. So I think now that we're going to have a stable prototype and that we're going to marry that control system to the prototype, it's a different conversation. So we plan to start those up again.
Right, but even like with the prototype, there's going to be like a level of iteration happening on your end, because when you have like the first people testing it, they'll say, "Oh, like I like this feature, not like I need this or that." So there's probably going to be some level of testing, right, as you're getting this user adoption.
I'm trying to open this up because all we have is this SLA, right? And this is all we have. But like the things when we have a full-sized, full-scale model, and like we have a response time. So like what does fast mean? How quickly can we respond with the corrective action? What is the corrective action? Like one of the corrective actions, if your bones are like chalk, if you're an older person, you will be lowered slowly to the ground. Well, what is the units of slow? And how fast is that? And if your bones are not like chalk, if you're a young person, you will be raised up, or you'll be able to get your legs under you, and or you'll be helped. What does that look like? And what is the finite element analysis we are able to complete doesn't include the tipping. Like I know this is a podcast, but you can understand that there's going to be a tipping nature to it. So I think that'll all depend on the center of gravity and where that is. And if it's too high on the person, people's center of gravity is not in their nose, right? So even know how bad your cold is at the time, it's probably not there. So there's going to be, for most people, and that's what we'll be able to, those type of questions. And we can't get clearance from the FDA, and we have to have clearance from the FDA to sell this device.
Right. So essentially where you're at now, what you're getting this prototype, you need to get clearance from the FDA, which will take some time. And then once you do that, you can easily sell it to who you need to sell it to. And in terms of getting clearance from the FDA, Have you started that process, or what does that process look like for people who don't know?
So it's a very high risk process. Like this is when people talk about the barriers to entry, it is a huge barrier to entry. There is a reason why devices take a long time. And if you're ever a patient and you take a drug, you want the FDA to thoroughly look at it. And my master's is in biomedical engineering. I want there to be a regulatory
For sure.
system out there. But it could be 90 days, or it could be 12 years. So
Right.
the regulatory system, obviously we want the 90-day solution.
Right. But you're saying that like that's kind of like the barrier for you from actually being able to go to market in a good way is them approving it, because you can't, nobody could literally pay you for the product until they stamp their approval.
Yes, exactly. Yes.
Right. So hypothetically, if they were to approve in 90 days from now and you had like the prototype, what would be your go-to-market strategy at that point?
Our go-to-market strategy is very dependent on the FDA approval at this point, but we sell directly to hospitals with, I think, the idea that healthcare workers are in demand. And if we can, I'm sure it's been discussed in Texas, because the violence to healthcare workers is ridiculous, but the ratio of healthcare workers to patients is variable, and this can maximize that. Not obviously, we're not going to eliminate healthcare workers. They need to be there's still bank tellers, even though there's ATM machines, but maximize their usage. So we need buy-in from the insurance companies and the healthcare workers.
So essentially kind of being a supplement for even like a home healthcare worker, if they're only able to work or like approved for certain hours, as you said, and the nighttime, they can use the device. They don't need to actually be billed, and it can save our government money too, as opposed to paying, for a worker to be there 24/7. So it kind of solves several problems, correct?
Yes.
Cool. So in terms of, your goals, right? So what would you say is your top business priority in the next few months with the product?
So my top business priority for the next few months is simply to make it through the next 3 months, but I would like to have some visibility. I would rather not come month to month and be like, that would be great. However, that being said, what my ultimate business goal is tied very much to emotionally. When I need this product, I want it to exist in every hospital. So when I created this idea, when I patented this idea, it was simply that I believed in something, that there has to be a better solution than like the healthcare worker I had taking me to the bathroom. And then, there's obviously a limit on that. And I want, when that is more of a need to me again, there to be a better solution. And those things are tied in my mind.
Awesome. And what is your biggest piece of advice for the ones who are going to start work on healthcare, or they are already working in the healthcare sector?
I think the healthcare sector is very much like business as a whole, and business as a whole is very much like boxing. And I think I think it's a Rocky Balboa quote, who wasn't even a real boxer, but he was talking about, it's not how hard you can punch, it's how many times you can get punched and keep moving forward. And this experience has been very humbling, and I get punched in the face a lot. I thought I was fabulous at engineering, but it turns out engineering was not the most important thing. To business foundations and business strategies, marketing are all important. So I think coming to that and valuing what other people do, I think, is very important. I wrote a book on imposter syndrome, and I think if you value other people and what they bring to the table, it limits that a great deal.
For sure.
That's
so true.
So if we're going to have this conversation again in 1 year from now, where do you see things going for the business?
I think a lot rides on having a prototype that's human size. Like in the St. Louis area, if it's, bringing it into somebody's office and being like, here you go, and seeing it, this is it. It amazes me how much I've grown in the last year. Personally, my comfort zone is now a dot to me. I think in a year from now, it'll be the same. I will look at the product and be like, wow, I'll learn a lot.
No,
I'll learn what fast and slow mean.
Right. No, it's exciting, and we're definitely rooting for you. So if somebody watching this wanted to reach out, do you mind sharing your website or social media, like the best way to get in contact with you?
I'm on LinkedIn, Sheila Buswell, and we have a website, buswellbiomedical.com. And the business has a website too, or like a LinkedIn page, Buswell Biomedical. But the buswellbiomedical.com, and my email address is Sheila Buswell at buswellbiomedical.com.
Awesome. Well, Sheila, thank you so much for your time. It was a pleasure chatting with you.
You also, Dan, thanks. And you,
Thanks.
Qasim.
Thanks, Sheila.
Although
All right. Thanks. All right. Bye.
Bye-bye.